Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Pregnancy After Age 35, presented by Dr. Saloni Mathur, OBGYN with Washington Township Medical Foundation. Dr. Mathur was raised in the San Francisco Bay Area. She earned her Bachelor of Science degree in Biological Sciences from the University of California, Davis, and her medical degree at University of Toledo College of Medicine and Life Sciences in Ohio. Dr. Mathur is excited to be back in the Bay Area to serve her home community. And now, please welcome Dr. Mathur.
Hi everyone, thanks for tuning in. I'm going to be talking today about pregnancy after the age of 35. Having a child after the age of 35 has become much more common in recent years, and while there are some risks and challenges to consider, there's a lot of options and resources that are available to older moms. So let's talk about it. First things first, it's very important to understand your definitions. So when you go to see your doctor, they'll be throwing out a lot of different terms, one of which is advanced maternal age. Now this is the term that we use the most, and it refers to any woman who becomes pregnant or will deliver after the age of 35. So even if you're 34, when you become pregnant but you're going to be delivering after you turn 35, you are still considered advanced maternal age. Geriatric pregnancy is an older term. It's used interchangeably with advanced maternal age, although not as commonly as it used to be. And then high-risk pregnancy is simply a pregnancy with an increased risk of complications such as gestational diabetes or preeclampsia. It's an important term to know because it is one that will likely be used by your physician. So why the age of 35? That feels like a pretty low number to me. And 35 outside of your reproductive years is, pretty young. Most people are just starting their life, getting comfortable in their careers, and deciding to start a family. Now, a lot of studies have shown that after the age of 35, there's an increasing risk of genetic abnormalities for women. There's also a significant association between chromosomal abnormalities and congenital malformations. And the effects of chronic medical conditions increases. And these conditions are things like diabetes, high blood pressure, and obesity. For those of us who are a little bit more science-minded, there are some studies that are interesting to read that talk a little bit more in depth about these increasing risks, such as the FASTER study or the NBDPS study. So feel free to peruse those on your own time. So things to consider. Fertility decline definitely starts to happen and should be considered for women over the age of 35. Pregnancy itself is higher risk, and we'll talk a little bit more about how that affects the maternal health and fetal health. So factors that affect fertility. This is probably the question that I get the most in the office about women who are planning to start their families a little bit later on in life. So the number one factor that affects fertility is age. We've talked a little bit about that already, but other things to consider are things like BMI, diet, and exercise. There's actually new research that shows that your DNA is actually, or the markers on your DNA are actually changed. So your epigenetics are changed depending on your diet and exercise. So if you exercise regularly and are eating a balanced diet, your ability to get pregnant increases with those simple lifestyle changes. Other things to consider are things like substance abuse. So alcohol overuse and abuse, drug use like marijuana, heroin, cocaine, all of those things can change your fertility and can actually decrease your chances of getting pregnant. Other things like chronic medical conditions and environmental factors like air pollutants, chemicals, and pesticides can also have an effect on your fertility. So what can we do to increase your chance of getting pregnant? Prevention is key. So like I've already said, lifestyle changes like avoiding smoking or alcohol use, changing your diet to be more balanced and healthy, and engaging in exercise can increase your chances of getting pregnant, even after the age of 35. Other supplements like folic acid, vitamin D, and iron supplements can also increase your chances of getting pregnant and increase your fertility. And then regular checkups. And by regular checkups, I don't mean just prenatal care. I mean annual well woman exams that check on your overall health and check on cervical cancer screenings, breast cancer screenings, your thyroid health, hormonal health, things like that that happen on a yearly basis. So you should be visiting not only your OBGYN, but your primary care physician. So what can we do to increase your chances of fertility? We've already talked about health and lifestyle modifications that you can make, but let's say you've done all of that and you're still not getting pregnant. There are fertility treatments that are available to you. Things like egg or embryo freezing can be considered, especially in your early 30s if you're planning to delay starting a family. And then once you've reached the point where you've had your eggs frozen or you've tried to get pregnant naturally, things like IUI or IVF can also be very helpful in getting pregnant. Alternative options outside of IVF are things like adoption or surrogacy and even egg donation. So there are a lot of different ways to start a family, and you shouldn't be discouraged if you're having difficulty. Now, let's say you get pregnant, you're older than 35. What are some of the risks and challenges that you may be facing? In terms of maternal health, complications like gestational diabetes, hypertension, preeclampsia are things to think about. So in terms of gestational diabetes, I've said this many times already, but eating a healthy diet and exercising are going to be key in reducing your risk of getting gestational diabetes. In terms of reducing your risk of preeclampsia or hypertension, there are similar things like a healthy lifestyle that can help, but after the age of 35, many doctors will recommend taking low-dose aspirin to help prevent vascular changes that can lead to preeclampsia in pregnancy. Fetal health complications like birth defects such as Down syndrome, Fragile X syndrome can also be a challenge, but these are things that we can screen for early in pregnancy and can be mitigated by, again, just taking care of yourself and making sure that you're seeing your doctor regularly. The other things to think about are challenges with labor and delivery itself, such as an increased risk of miscarriage after the age of 35, preterm birth, and even stillbirth. I know we've talked a lot about challenges and risks that you might be facing, but there are a lot of support and resources that are available to you. For example, mom-to-mom groups, a lot of online mom-to-mom groups, and even in-person groups where you can talk to other women who are going through a similar journey and can talk about the challenges that they faced and what they did. And that can be a really encouraging place to start. If you are pregnant after the age of 35, prenatal classes can be extremely helpful. They can talk to you in a group setting about what to expect when you're expecting, and interventions moms have taken while they were pregnant that have helped them through their pregnancies. And then, of course, professional help. Your doctors here at Washington Hospital and Medical Group are always available to help you through any challenges that you might be facing. In conclusion, it's never too late to start a family, and there are lots of options that you and your physician can explore together to make this journey as smooth as possible and start a family of your own. At this time, I am going to open the floor to any questions that have come up.
Okay, thank you, Dr. Mathur. We do have some questions. First question is, how is male fertility affected later in life?
Yeah, that's a great question. So I've talked mostly about fertility as it applies to women, but male fertility does change. It's not doesn't change as predictably as female fertility, but usually after the age of 40 to 45, male fertility also starts decreasing. It's important to note that while men are still able to conceive, the quality of sperm, quantity of sperm can change so that their fertility is also affected. Similarly, women, as you get older, the quality and quantity of eggs decreases, and that can change the genetics that can lead to genetic abnormalities that we discussed earlier in this presentation.
Okay, thank you. Our next question is, if I am worried about birth defects, what can I do?
That's a great question. All pregnant patients are offered genetic screening. Now, if you decide to go to a reproductive endocrinologist to do IVF for your fertility treatments, or if you get pregnant spontaneously, all women are offered genetic testing in their first trimester to help understand their risk of their baby developing genetic abnormalities. And those tests will test for muscular abnormalities, spine abnormalities, things like Fragile X and Down syndrome.
Okay, and our last question we have for today is, can vaping have negative effects on my pregnancy?
This is a great question, one that I don't think many people think about, but is very significant to talk about in today's community. While vaping is advertised as a way to help you quit smoking or as a healthier alternative to smoking tobacco, it can still have negative effects on your fertility and your fetal health. So vaping may not have as high levels of tobacco, but it does have other chemicals that can have an effect. So keep that in mind when you make choices about substance use.
Thank you. Dr. Mathur, thank you for this insightful presentation. This does conclude our program, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.